Okay, so good morning, and I hope you're doing well, and I hope things are okay with you, and I hope life has been good. And if life hasn't been good, you have to make it good because you know one thing that you are the co creator of your reality. Where you are right now, what are you going to do a little later, in what part of life you are in, depends exactly upon your choices and what you do. Nothing else. So, with this, let's start a remedy for today. I'm going to continue my ideas and series on exploring new remedies because I think one of my role as a homeopath for today's times is setting the benchmarks to for all of you to show you how we can think out of the box and have better results in today's times. All right, so we'll talk about a very interesting remedy, Anthrokokali, and I've had a few clinical experience with it, and I'm able to build up a drug picture of this remedy, and I hope that I can share this with you. So Anthrokokali, it's an anthracite coal. Okay, so it's a carbon dissolved in boiling caustic potash trituration. I'll tell you of interesting clinical experience. I had an interesting case, a bad case of chronic skin pathology, ringworms, eczema, lichen planus, itchings all over the body in an old man, not improving by any medicine. And he gave few very peculiar symptoms. One of the most peculiar symptom was that he sweats a lot. And where does he sweat? He sweats on the lower limbs, and these lower limbs are very sticky. The perspiration is very sticky. So when I opened the repertory and I looked at some a very interesting rubric, I found a very interesting rubric. One is perspiration sticky. Okay. And then I found, very interestingly, perspiration sticky in lower limbs and feet. And there are only 7 remedies there. One of them is Anthrokokali given by Clark. So I started reading Clark. Okay. I also read Clark and I saw that's one of the most important remedy for any kind of eczema, any kind of herpes, any kind of impetigo. In fact, there are indications like that of petroleum. It has been used in skin affections, scabies, prurigo, chronic cracks, ulceration, nostrils. Very interesting. This I didn't know. And then I started studying a little bit more about Anthrokokali. And let's see what is Anthrokokali. So, very important for skin pathologies, especially when there are vesicular and skin thick pathologies on scrotum, on hands, on tibia, on shoulders, on dorsum of the feet. Also has some rheumatic issues, has a lot of gas, extreme thirst, and you have nothing else. Think about this remedy then. I'm going to try to evolve a little bit more about this remedy. Um, its constitution is very scrofulous, so there's a lot of glandular pathology. There's a lot of chill alternating with heat in this remedy also. Very important for chronic skin pathologies, chronic ringworms, chronic impetigo, lichen planus, scabies. Wherever there are eruptions, the part is this is a very important rubric. Eruptions, parts affected, cold or warm, and mainly itching is at night. So night itching, ringworm itching at night. Think about this. Um, a little psychotic miasm, ringworm and psychotic miasm. Rheumatism, very important this remedy. Sweat on affected parts, and the sweat is warm. You know, cold sweat is viratrum, carbovage, and especially sweat is at night. These are some interesting symptoms. Um, Also, itching around the orifice and around the urination area is also this remedy, Anthrokokali. What else I want to tell you about this remedy? Let's see. In mind state, not much is given except for they can be restless and sad, not much. But I would like to tell you they are carbon-like. So carbon-like, so they are very very sensitive. They are they are people who are who will want to be independent but are very very dependent, like petroleum. I believe it's also a fast-paced carbon, like petroleum, and very important for cracks, chronic cracks. When other remedies fail, think about this remedy. Um, this is a very interesting rubric given by Clark. Better in daytime, aggravated night. So this is a little bit syphilitic miasmatic rubric. Interestingly, uh, the great Rastogi has spoken about it being one of the top remedies for any kind of scabies and ringworm in low potency. This would be the top remedy for him. And like how many homeopaths use hydrocotyl asiatica, this could be a very important remedy in today's time. Um, lot of eruptions are aggravated during full moon. Very important. People who have a lot of skin pathologies and very slow course of disease, slow repeated desquamation around the scalp. Eruptions are preceded by fever and characterized by redness, swelling near the borders of erysipelatous, inflammation, and there is a slow course. And that's why cases where you're thinking of sulfur, graphitis, chronic skin pathology not improving, think about going Anthrokokali in 6C or 30C potency. Repeat a few often, and you will see some very good changes in 1 month. But it will not totally reverse, it will improve a lot and then may require another remedy. So, this is a little bit I wanted to share with you. It's a very interesting remedy, very, very, very interesting remedy that I think in today's time one should know, and this kind of knowledge can help us a lot. So, some thoughts about this remedy I wanted to share with you, and I hope that you can use it the way I'm using it as well. Stay strong, mind over matter.